My name's Gina Buckholes. I'm one of the advisors at 401k Plan Professionals. And on behalf of our team at 401k Plan Professionals, I just want to tell you thank you. This is a great topic. It's very informative. And we look forward to letting Ron present on this great topic. This webinar is part of our webinar series. Thank you, Ron. And our webinars, we are now hosting about one webinar every month. Most of our webinars are about 30 minutes. Today, because we have so much great content, it is actually an hour, and we'll try to leave time for that Q&A. You will always get a recorded link. So if you've registered for this, you will get a recorded link, and you are welcome to share that with others. View it again if you want, but please feel free to distribute that as needed. And also you can find all of our webinars, past webinars, and registration for our upcoming webinars at our website at 401k Plan Professionals. We do also have a YouTube channel where you can find this information as well. And I will go ahead. That's pretty much all I have. I'm going to go ahead and introduce our guest speaker. There's our YouTube channel. Very excited to have Ron Bezis presenting today on this great topic. Ron is a director at John Hancock Investment Management. He brings over 20 years of experience in the industry. He works a lot with advisors, sharing content like this, Medicare, really important topics with advisors, so we can bring this to our clients as well. I saw Ron do this presentation a couple of months ago. He did such a fantastic job of taking such a complex topic and making it understandable. I was like, hey, Ron, can you come over and do a presentation for our clients? And he graciously agreed. So I'm going to turn it over to him. He's got a lot to cover. And thank you, Ron, for joining us today.
Absolutely great. Thanks so much, Gina. And thanks to the entire 401k Plan Professionals group for having me here today. I'm Ron Bezis with John Hancock Investment Management. And thank all of you for attending, and welcome to our session on Medicare 101 and understanding Medicare. And as all of you know, retirees are faced with many topics that they need to know about, and some are more important than others, such as really understanding Medicare and the impact it can have on someone's long-term financial plan. I think that by better understanding Medicare, we can not only better prepare for future healthcare costs, but we can also help to avoid making mistakes as we go through that process. So that really brings us to our goals for today's discussion, which are twofold. First one, of course, is for all of you to walk away from this discussion with an enhanced understanding of the Medicare system and how it works and how it operates. And the second goal, which is arguably the bigger challenge for me, is to do so in a way that's not going to put all of you back to bed here. Because I don't know if you've heard before, but the Medicare content is known to be a bit on the dry side. So my goal today is to really talk about this material in a way that's going to keep all of you engaged and entertained as we go through it. So with that, let's dive right into the presentation. And as you see this couple here on the screen before you, a few things might jump out, okay? That could be looks of utter confusion, being lost, trying to connect the dots, etc. I can tell you why that is. It's because this couple is turning 65 years old this year. They're eligible to receive Medicare, and they're trying to figure out what in the world is going on with it. Because for the last 6 months, they've been getting inundated in the mail, right? A whole big stack of paperwork they're trying to read through, and flyers and forms and documents and all this stuff. And as they're trying to read through it all, they have the telephone keeps ringing in some telemarketer trying to sell them some form of a Medicare Advantage plan. And then when they want to take a break and walk away from it all, and they turn on the TV, it's like 10,000 commercials with people like George Foreman and Joe Namath talking about how great their Medicare Advantage plans are. And it's a lot, and it's daunting, and it's confusing, but it's so important. And we ask, is this how Medicare makes you feel? Because it's what we find it makes most Americans feel. It's confusing, and it shouldn't be, because it's so important. But the good news, the very good news, is that we're here today to really break all of this down. And the way we're going to do that is by following the agenda that you see here on the screen before you. Before we move forward, I think it's really important to take a step back and talk about the history of Medicare so we can really just wrap our heads around the magnitude of this topic and what we're going to talk about today. After we do that, we're going to go into the different parts of it and what's covered and when you would actually enroll, how that's going to look. Following that, we're going to take a look at what it might cost you on a monthly basis so you can begin to kind of prepare for what these costs might look like for you. Following that, we're going to certainly take some time, and what we're going to do is a comparison of Medigap plans versus the Medicare Advantage plans. Those are questions I get asked all the time. So we're going to take some time to talk about that. And then we're going to wrap up by talking about working past age 65, which is another really hot topic and something that we're going to break down as well. So that is the agenda for today. And let's dive right into the history of Medicare. Okay. And as you can see here, the big day, right, was July 30th, 1965. President Johnson signed Medicare as we know it today into law. Now, why was this such a big deal? Well, it was such a big deal because at the time, the United States really had no form of standardized health care for retirees. In fact, only about 50% of Americans who retired or reached that retirement age actually had some form of health care. And this was a big, big problem in the United States. About 8 million seniors were living in poverty because they couldn't afford their health care bills. They didn't have any form of health care. And think about how sad and heartbreaking that really is, that you had folks who, worked their whole lives. They had group coverage, as did their families through their employer. And then they go to retire to live in their golden years and they don't have any health insurance and they're living in poverty. I mean, this was, again, a really gigantic deal in the United States. And several presidents tried to get something passed unsuccessfully. Really started with Roosevelt, JFK. He tried to get something passed through Congress. And then you can see here in the middle, President Truman really, tried to get something passed for Americans, which is why when President Johnson was finally able to do so, he wanted to honor President Truman for all the effort he put into it, gave him and his wife cards 1 and 2, and then we saw 19 million Americans enrolled in Medicare. So that was back then. When we fast forward to today, there's about 65 million Americans enrolled. Today, many folks are forecasting that by 2030, which is kind of frightening to say, but it isn't that far away, there's going to be about 72 million Americans enrolled in this. I mean, this is huge. And speaking of huge, they're forecasting that it's going to be about 20% of the U.S. budget. Think of how astronomical that number is as all the things we spend money on, as a country. Think about COVID relief, right? That has to be paid back. The Ukraine war efforts, we just spent another, X millions of dollars over there the other day. I mean, that's all the stuff that we write checks as a country. And the fact that this is 20% is a big, big deal. So I think it's really important just to, again, understand the magnitude of how large this really is. So that's the history. Next, let's get into one of my favorite slides. I'm confident they put this in just so I do the Boston accent slide. So I'm going to say this the way they put it in, where Medicare starts with the parts, right? That's how I'm supposed to say it. But with that, Medicare does start with the parts. And there's only 4 parts of Medicare. Most of you probably know what they are. It's A, B, C, and D. We're going to talk about each one. And we're going to start with Part A. So when you hear Medicare Part A, that is going to cover everything that takes place within the walls of a hospital. Okay, that's your hospital coverage. Any sort of inpatient hospital stay is going to fall into Part A, as any sort of skilled nursing you might receive. Maybe you're going to receive medication, blood transfusions, right? Things like that, hospice. All of that's going to fall under Part A. So think of Part A as your room and board within the walls of a hospital. Part B is your outpatient. So it's pretty much going to cover everything outside of that. So that's going to cover, seeing your doctor for an annual visit, any sort of lab work you might have done, any sort of outpatient surgery, any medical equipment you have in your home, right? All things like that are going to fall under Part B. Now, what's great about Part B is anything that's considered preventative, as you can see here at the bottom, the government's going to pay for all of it. They're going to pay for 100% of that cost. Meaning such things as, what do I mean by preventative? Well, a flu shot, COVID vaccines, annual doctor, physical visit, colonoscopy, right? Things like that, they're going to pay for all of it. Anything they don't deem as preventative, they're going to pay for 80% of it, which means that all of you, right, and all of us, we're on the hook for that 20%. And as you see this gentleman here laughing on the screen before you, it's very possible he's having a grand old time because he doesn't know he's on the hook for 20% of that reconstructive knee surgery he's in there for. But the good news for him and really for all of us is there's ways we can plan for that cost. But it's important to understand that cost because that's what's covered under original Medicare. So when you hear the term original Medicare, that only refers to Part A and B, as those are the only two parts we get through the federal government, through Social Security, okay? Part C and D is not mandatory, and you would get Part C and D through a private insurer. Now, when you hear Part C, that is synonymous with the Medicare Advantage plans you probably heard about as well. And the way this works is we have the option of going through a private insurer, of getting all our benefits under one roof, right? Under one umbrella. So when you hear Part C, almost think about that like a travel agent, okay? Where you would get your flight, your rental car, and your hotel stay all under one roof, okay? That's very similar to the way the Advantage plans work, where you're getting everything under one umbrella, okay? And then moving on to Part D, what's going to fall into Part D is any sort of prescription medication needs someone have. So whatever drug needs you have, you would want to get a Part D plan to cover any prescription medication that you have. So those are the four parts of Medicare. We just talked about that. Next, what we're going to talk about is, when do you actually enroll in Medicare? What does that look like? And I'm going to start with number 2 first, as I think that's the easiest of the two. And again, I said you're eligible to receive Medicare when you're 65. Say someone decides to enroll in receiving Social Security benefits prior to that. Say someone's 63 years old and they enroll in Social Security benefits. The government's going to automatically assume, if you're taking a Social Security benefits, that you're going to need Medicare, and your enrollment is automatic, as you see here. In fact, a month or two before your 65th birthday month, you're going to automatically receive your Medicare card in the mail. So nice and easy. If you're not yet taking your Social Security benefits, let's go to number 1 here, and it's still relatively easy. You would just go to the Social Security website, which is ssa.gov, and you would enroll. It takes about 10 to 15 minutes to do so. And the way that would work is depending on your birthday month, okay? Depending on your birthday month is going to open up what's called your initial enrollment period. What happens during this period is you have a 7-month window to enroll in Medicare, okay? So you have your birthday month to enroll. You have 3 months prior to that, and then you have 3 months following that to enroll in original Medicare. So let me give you an example of what I mean. And as you can see here, we're going to take the example of someone who turns 65 on May 20th, okay? This person's window to enroll in original Medicare would begin right here on February 1st, and it would go all the way to down here on August 31st to enroll in Medicare. Now, if someone enrolls prior to their birthday month, right? Say someone decides to enroll, again, opens up February 1st. Say someone decides to enroll today, okay? If they enroll prior to their birthday month, the benefits would kick in on the first day of their birthday month. Meaning, if someone enrolls today and their birthday is May 20th, their benefits would begin on May 1st, okay? However, if someone enrolls on their birthday month or after it, then the benefits are delayed until the first day of the following month. Meaning, someone decides to enroll on, June 10th, their benefits would kick in on July 1st, okay? So that's the way the initial enrollment period works. If for some reason someone misses their initial enrollment period, it's okay, because in the first quarter of every year is open enrollment for original Medicare. Not to be confused with the fall during the annual election period. That's a different thing that we're going to talk about later. This is only original Medicare, and you'd have, from January 1 to March 31st to enroll in original Medicare. Before we move on, I do quickly want to hit on if someone works past their 65th birthday. Again, it's a question I get asked all the time. So the way that would work is, say someone doesn't want to enroll in Medicare at 65, they want to stay on their group benefits, and they retire at 68, or they grew off the group benefits at 68. The way that would work is then you would have your own unique 8-month window, depending on when your group benefits end, to then enroll in your initial enrollment period. Okay, that's going to be dependent on your last enrollment date within your group benefits. Okay, so that's how that works. We can move on because we have a lot to talk about. We just kind of recapped all of this, and then we're gonna go into the cost sharing. And I think what's nice about Medicare to understand is it works very similar to group insurance as we have it now, where we pay our monthly premiums, okay? And then we have co-pays and co-insurance depending on the different procedures that we have done. So Medicare works very similar to that. And taking a deeper look into that, we're going to start with Part A. Now, what's great about Part A is if you've worked for 10 years and you've accumulated right here 40 quarters of work history, then Part A is considered paid up. Costs us nothing at all. It's on the house. Because we know a portion of our FICA taxes goes into Social Security, right? And we know the other portion goes into Social Security, goes into Medicare, okay? So as long as we have that 10-year work history, then Medicare Part A is paid up. Now, sometimes I get asked, for folks who have 30 to 39 quarters of work history, Medicare Part A will actually cost that person about $250 a month, okay? And anyone who has below 30 quarters, it can be quite expensive. It's $500 a month just for Part A. So sometimes people will ask me, they'll say, hey, I have, 38, 39 quarters of work history. What should I do? Should I get a part-time job? And I would say, absolutely, you should, because it doesn't matter how much money you're making. What matters is you're paying into the system, right? You're paying your FICA taxes, and we would want that person to get from, 37, 38 quarters to the 40, so then Part A will cost them nothing at all. However, there is a few ways you could qualify through a spouse that we're going to talk about next here, as you're going to see at the bottom. So if your spouse is eligible to receive Social Security benefits, right, they don't have to be taking them. They would just need to be of that eligible age, and you would need to be married at least 1 year. Of course, you would need to be 65 years old. Then you could qualify through a spouse. Moving down below that, believe it or not, you could actually be divorced and get it through an ex-spouse. And the way that would work is you would need to check 3 boxes. Your ex-spouse would, again, need to be of that eligible Social Security age. You would need to have been married for at least 10 years, and you would still need to be single. If that person checks all 3 of those boxes, then they could qualify through an ex-spouse. And then moving here to the bottom is in a widow situation where you're married at least 9 months prior to date of death, and you're still single, then you could qualify through a deceased spouse as well. Okay, so that is Part A. And next, we're going to talk about Part B and D. We're going to table Part C. Again, those are the Advantage plans, and that's a whole section we're going to talk about a little later. But now we're going to talk about Part B, and we're going to look at the monthly premium. As you can see here, is just about $175 a month. Okay, that went up from last year. Last year went down for the first time in a decade. This year, the government jacked it right back up. Okay. And if someone's taking Social Security benefits, then they don't have to do anything at all to pay for that monthly premium. That is taken right off the top of their Social Security benefits. If someone's not yet taking that, then you're not billed on a monthly basis. You're actually billed on a quarterly basis. And you could go, you could go right to that SSA.gov website to set up like an auto easy pay type thing to pay for that. Okay. Next, we're going to move to the bottom. We're going to talk about something called IRMA. This came out in 2007. I can promise you no one was happy when this came out. This is something that hits high income earners. Oftentimes when I do this live in the room, I get moans and groans. Some of you have heard for that. You probably made that and I just can't hear you because everyone's muted. And basically what this means is the more money you make as a household or as an individual, the more money you're going to pay for your Part B and your Part D premium. Let me tell you more about what I mean by that. So if we have an individual that is going on Medicare this year, they turn 65, they want to go on Medicare this year in 2024, the way it's going to work is the IRS is going to do a 2-year look back on what your adjusted wages look like, meaning they're going to go back, in this example, 2 years to 2022 and look at the amount of money that you make. So let me give you an example of an individual who files joint and that household makes, let's say $300,000 a year. Okay, we'll make it nice and easy. Well, they're not paying the $174.70, okay, for their premium. That's only for households who make below 206 or an individual who makes below 103. In this example, this $300,000 household, well, they're going to be paying about $350 a month, and that's each one of them. That's not the household. So when IRMA kicks in, it can certainly be quite expensive. And a lot of times what we find is folks don't know about this until it's often too late or until they get whacked with one. People freak out and they're like, I budgeted for $175 and it's double that as my spouse. And, people didn't plan for that. It can be detrimental to someone's, retirement budget, things like that. So some of the things that, you might potentially, you can't file an appeal. And some of the things the government probably would grant you an appeal for would be the following. It would be if you, retired, okay, you're no longer working, or you reduced your hours, things like that, okay? In those situations, the government probably would grant you the appeal, and you would file a form called Form SSA-44, just saying that, hey, I reduced my hours, I'm retired, things like that. They probably would grant you the appeal for. On the flip side, some of the things, a little bit of tax planning for all of us to be aware of some of the things the government probably would not grant us the appeal for. So as you're approaching the 2-year window, knowing that you're going to enroll in Medicare at a certain age, these are some of the things you want to be aware of. If you took a large IRA distribution, 401k distribution, right? Things like that. If you received a large inheritance, maybe you sold a boat, beachfront property, things like that, okay? The government probably would not grant you the appeal for, and you will get whacked with an IRMA. So if you're going to be, taking any of these things, it might be advantageous to take that before, there's a 2-year look back on when you're going to be enrolling in Medicare, because again, we're trying to save you some money. These are some of the mistakes we can avoid making as we go through the process, being aware of that. Now, before we move on, I will say that if someone does get hit with an IRMA, maybe someone received a large inheritance, odds are you're not going to receive that inheritance every year. So the 2-year look back would eventually roll off of your tax return. So if you do get hit with an IRMA, it doesn't stay with you forever. There's always that, 2-year look back, and eventually in some situations it would roll off as well. Okay. So that's covering IRMA. And next we're going to move on to the Part D premium. Again, this is going to cover your medication needs. And you can see here that there's a bunch of different plans you would enroll into depending on your medication needs, all the way from, $0 a month to well over $100 a month. These are going to vary because everyone varies on medication they take, with the national average being just about $55 a month. Okay. Now, let me slide down here and bring up before that I said Part D isn't mandatory. And that is true, but it doesn't mean that the government and Medicare doesn't track your enrollment. In fact, there's a penalty if you enroll in Part B and do not enroll in a Part D plan, but do so at a later time. Let me give you an example of that. The penalty is 1% each month that you enroll in Part B and you didn't enroll in a Part D plan. So let's say we have an individual who's 65 years old, they're enrolling in Medicare, they're healthy as can be, they have no medication needs, and they say, why in the world would I get a Part D plan? I don't take any medicine. I think that's logical, right? I think we would all have that similar thought process. Now let's fast forward 5 years, and that same individual now becomes sick and they have a medication need, and they go, hey, I'm going to enroll in a Part D plan. Okay, I need some prescription coverage. The way the penalty is going to work by the government is the government's going to say, wait a minute, you enroll in Part B at 65. Now you're 70. Okay, there's 5 years or 60 months, 1% a month. Guess what happens? There's now a 60% penalty tacked on top of your Part D premium that never goes away. Once the government slaps you with the penalty, they're very unforgiving with that. And guess what? Similar to IRMA, people don't know about this. And why would you? Medicare is so confusing. People don't know about this until it's too late, until they get hit with that penalty, and it sticks with them forever. So something that might, work for everyone is to just enroll, if you want to go this route, just enroll in a Part D plan when you enroll in original Medicare to make sure that you're locked into a plan. Okay. It doesn't matter if you're paying $2 a month. The important thing is that you have some sort of coverage. If, later in life, your medication needs increase, then you could get a new plan, which is fine. And the important thing is that you were originally in the plan, so that penalty would not apply to you. Okay. Again, a lot of these things, people don't know about them. And when they get hit with a penalty, it's very unfortunate, as Medicare can be expensive enough on its own. We don't want to make it any more expensive than it needs to be. Okay. And unfortunately, IRMA rears its ugly head as well as it relates to Part D. Let's take that same example, same couple making $300,000 a year, and we slide over. Well, they're paying an extra $33 a month on their Part D premium. Now, what I will say, if you file that appeal for Part B and it got approved, the nice thing is that it's going to automatically be approved for Part D as well. You wouldn't have to go through that whole process again. Flip side also being true, if they deny you Part B, they're going to automatically deny you Part D as well. Okay, so the two work hand in hand with that. Okay, so those are the premiums. Next, let's go into the cost sharing, and we're going to start with Part A. So you can see here, your Part A deductible this year went up a little bit from last year, is $1,632. So say I slip and fall on some ice and I break my knee and I have an overnight stay, boom, I'm getting hit with that 1632 right off the bat. Now, let's say for an example, someone's in the hospital for 60 days as a result of something, that's going to be fully covered under Part A. But then on day 61, a copay begins, and it's a 408 daily copay. 30 days on day 91, that doubles to $816 a day. See how expensive this can get? Then on day 150, we're paying all the costs, and that's going to be through the roof. Okay, so really just important to know how the Part A, all the costs and things like that work. They're going to cover the first 3 pints of blood, okay, as long as they have it in the hospital. If they don't have it in the hospital, guess who's paying for that? Us. And then they're going to pay for 20 days in a skilled nursing facility. On day 21, a copay is going to kick in at $204 a day, and that's going to go all the way to day 100. If we're in there for that long, on day 101, we're paying all the costs for that. But then keep in mind, Part A isn't meant to be long-term care insurance. That's another whole insurance product on its own. This is, what's covered under the government. This is the base model. Think of it that way. And I think a lot of Americans have the misnomer that they think, hey, I paid my FICA taxes. I'm going on Medicare. I'm on their, bill now. They're going to pay for it all. They're going to pay for some things, folks. But as we go through this, you can see that we're on the hook for a lot of these things. And it's important to know what the costs are going to be potentially. So again, we can plan for that. And you can work with 401k plan providers to plan for that, okay, as you go through that process. And also know what expenses are going to look like. And then just different ways, again, we can plan for some of these expenses, different insurance products that can make these a little bit easier on you as well. We're going to talk about that in a moment. I just want to paint the picture as to what the government is going to pay for. Again, this is under original Medicare. This is A, and then this is B. This is original Medicare, okay? You can see here, the Part B deductible is $240 a month. Remember in the beginning, I said they're going to pay for everything, preventative at 100% of the cost. Then recall, I said anything they don't consider preventative, they're going to pay for 80%, and us being on the hook for that 20% co-insurance. And look here, that is uncapped, okay? We pay 20% out of pocket forever. Think if someone got cancer and needed chemotherapy. Think of how astronomical 20% of that medical treatment would be. I mean, that could wipe away someone's retirement savings. I mean, how devastating and heartbreaking would it be to get sick and get hit with a 20% uncapped expense that you really can't do anything about? Or how can we plan for that? How can we cover the gaps that exist in original Medicare? There's 2 ways you can do it. We're going to talk about both ways. One is you could get a Medicare supplement plan known as a Medigap plan, if you've heard that. And the other way is getting one of the Advantage plans. Okay, those are your 2 options. And we're going to talk about Medigap plans first. The way these work is these are certainly the more expensive route. I would say if you could afford this route, I'd probably encourage you to take this route because yes, you're paying a higher premium. Okay, certainly paying more, but then you're getting a lot more coverage, of course. There's a lot less cost sharing, a lot less unexpected costs associated with it. Okay, your other option is getting an Advantage plan. And these are certainly cheaper. You're paying a lower premium, or in most cases, no premium at all, depending on the plan you get. But keep in mind, there is a higher cost sharing to it, meaning potentially a lot higher unexpected out-of-pocket costs. Pros and cons to both. Depend, for everyone's situation is different. The important thing is that we're educated on how these work. So then once we decide to go into one of these, we're making the most educated decision for ourselves. Okay, let's talk about Medigap plans. Why people love these plans is we're not dealing with doctor networks. So you can see here over 1 million providers available. Basically anyone, any physician you want to go ahead and see, you can go ahead and see that medical professional for your treatment. Okay, so people love them for that. Also, people love these because they're great for travel. Again, you're not dealing with networks. Again, I mentioned I'm from the Boston area. A lot of people like to get out of the freezing cold winters, as they probably like to do with all of you where you live as well. Freezing cold for me isn't fun. And for folks who move to, or are snowbirds and go to sunny, Texas, South Carolina, Florida, things like that during the wintertime, the Medigap plan would travel with them. Okay, so they're great in that regard. And also they're pretty easy to understand, meaning that the coverage you get is standardized. And on the next slide, I'm going to tell you what I mean by that. There's 10 Medigap plans available, okay? And basically, you can see here, what you see is what you get. So if you decide that Plan G is best for you, well, it doesn't matter if you get a Plan G through Blue Cross, Aetna, Cigna, United Health, etc. What falls under a Plan G is going to be standardized across the board. The only thing you'd want to do is you'd want to shop who's going to give it to you at the cheapest rate, right? But keep in mind the coverage is going to stay the same. And these are great because they're meant to, supplement, or hence the name, right? Pick up the gap that exists in original Medicare. And remember that, example I gave you, I broke my knee and I'm in the hospital overnight and I'm paying that Part A deductible, which is the $1,632. Well, if I have a Medigap plan here and we look at our grid and say I like plan G is good for me, okay? Medicare Part A deductible, 100%. I'm not paying that expense. My Medigap plan is paying that expense. And you can see here all the different hundreds, 50s, 75s. As you can imagine, the more coverage is going to be more expensive. So you can kind of customize this to the amount of medical coverage you want and what you can afford. But again, this is one option that will cover the gaps that exist in original Medicare, so that we have some sort of insurance coverage if folks become sick and need some sort of treatment as well. Okay, so these are the Medigap plans and how they work here. And then, like any sort of insurance product, as you can imagine, it's going to depend on how old someone is for pricing, where you live, okay, gender, tobacco use, right? All those kind of classic insurance type things. Areas where there's less retirees, they're going to be cheaper. Where there are more retirees, it's just going to be more expensive, right? So Medigap plans works that way as well. And what we want to do on this slide is I want to put it all together for you so you can kind of get a sense of what this option might cost you. Because I know so far I've been throwing a lot of, different dollar amounts at you saying, this is going to cost you this is going to cost you that. Let's put this option all together so you can get a glimpse as to what this, an estimate as to what this might cost you. So this is the option you have of going original Medicare A and B, getting a Medigap plan to pick up that 20% gap in original Medicare, and then getting a Part D plan for your medication needs. This is the option you have to you, okay? Let's say Part A is paid up, right? We worked our 40 quarters, and that's on the house, so that costs us nothing. In this example, let's take IRMA out of it and say the Part B premium is $174.70. We'll take the national average for Part D at $55.50 a month. And then Plan G here, you can see this $100 quote. If anyone lives in Texas, that's a pretty fair quote. This is where the folks who created this presentation for John Hancock, that's where they're located. So they quote that $100 amount for Plan G. I can tell you in Massachusetts, that's going to be about $250 a month. I'm not exactly sure in your region what it's going to be. Hopefully a little bit more reasonable for that. But say for about $350 a month. Again, this is the more expensive option, but just say for about $350 a month, this is an excellent option for you to get a really sound medical plan with all the different, kind of bells and whistles covered. So, you can kind of factor in about $350 a month for this route, okay? Now, moving on to this slide, I often say I think this is the most important slide, arguably, in the presentation, and I'm going to tell you why. It's because when you enroll in Part B, the clock begins to tick on this one-time 6-month window you have to enroll in a Medigap plan without any sort of health questions, okay? So if you have cancer and you need chemotherapy, you're going to absolutely need a Medigap plan to pay for that. If someone has Parkinson's, right, things like that, they're going to want a Medigap plan to help pay for all that. And as long as they do so within 6 months of enrolling in Part B, then they cannot be denied coverage with any sort of health questions. Any plan that you think is best for you, you can go ahead and get that plan as long as you get it within the 6 months of enrolling in Part B. Now, if you miss that 6-month window, that doesn't mean you can't get a Medigap plan at a later date. What it means, and let's slide over here, what it means is now you're going to have to go through underwriting because it's an insurance product. What that means is that the insurance company is going to do a 2 to 5 year look back on someone's health history. And if someone has underlying health conditions, maybe someone's in remission or something like that, you know, there's a really good chance if they have those underlying health conditions that they're not going to insure you and give you the Medigap coverage that you need. If you're healthy, you're probably fine. But if you have those underlying conditions and you miss the 6-month window, when it's gone, it's gone. Really important, folks, on this slide to walk away knowing that federal guideline. Okay. Because it's on a slide, I'm gonna quickly speak to this. It's kind of a niche situation, but what this means is, say you decide to not go the Medigap route, say you decide to go the Advantage route, and the insurance company is no longer offering that plan in the area that you live, and you don't have any coverage, right? In that situation, you would actually have 63 days of losing credible coverage to get a Medigap plan without any sort of health questions as well. Okay, you can slide right into any plan that you want. Okay. So that's the way it works for there. And again, really important to know that federal guideline. In fact, 38 states take that federal guideline approach. Now, if any of you on today's call live in any of these states, the good news for you is these 12 states take a much more lenient interpretation of that federal guideline. I live in Massachusetts, and I can tell you that folks here, every February and March, they can enroll in a Medigap plan or change their plans, right? There's a lot more flexibility around that. New York, for an example, it's open enrollment all the time. They don't have that 6-month window. They can get a Medigap plan anytime that they want, which sounds great in that regard. The bad thing for New York residents is they have the most expensive rates in the country. They have to pay for that privilege. It's very, very expensive. Okay. But again, most of the United States follows that federal guideline with the one-time 6-month window I just talked about. And it brings us to Medicare misstep number 1. And it's, folks, confusing what we all know is that annual election period in the fall that we have from October 15th to December 7th to get Part C or Part D plans, right? Go in and out of those. And people will say, oh, hey, I'll just get, a Medigap plan in the fall during the annual election period. No, you can't, because if you miss that 6-month window, you can't get it in the fall. You can only get Part C and Part D. Okay. So that's definitely Medicare misstep number 1, is not understanding how the two of those work very differently as far as Medigap versus the Advantage plans. Okay. And wrapping up on the Medigap is what you'd want to do is simply ask your physician, do you accept original Medicare? If they do, they're going to automatically accept Medigap. We know that we talked about the plans being standardized, right? All 10 plans. What you see is what you get. All you'd want to do is shop which insurance company is going to give it to you at the cheapest rate. Really important to know is that they're guaranteed renewable, meaning if you have a Medigap plan and you become sick, the insurance company cannot deny you re-upping that plan as a result of the sickness. They must guarantee you being able to renew that Medigap plan with them. And we know that the benefits don't change, which is great to know. The premiums probably will change, right? They'll probably increase those on you, but just know the benefits don't change. And why I think that's important to know is because with the Advantage plans, we're going to talk about a little bit later, the benefits can change. It's really important to know they can change with the Medicare Advantage plans. With the Medigap, they don't. Okay. And then, of course, you'd want to add a standalone Part D plan, which is going to cover all your medication needs to that. Now, if Medicare isn't confusing enough, guess what? Part D has its own 4-step process on pricing. So yeah, the rabbit hole gets deeper and deeper, but I'm going to do my best to explain the way the Part D pricing works. So first you have your deductible. After you fulfill that, you move into where most people live, and that's the initial coverage period. If someone breaks through that ceiling, you then would move into the coverage gap. Okay, what's called the coverage gap. And then the good thing is that there used to be something called catastrophic coverage, the 4th phase. This year, just a few months ago, the government actually did away with that phase. So we can actually kind of throw this one out the window. This one no longer exists. So, but I want to tell you more about what I mean by the pricing, because you're probably wondering what is he talking about with the 3 or 4 different stages. So first is your deductible. The federal max on these is $545 for your deductible. Not every Part D plan has that deductible. That's just this year the max on that. Okay. Once you meet your deductible, you now move into, like I said, where most people live is the initial coverage period. And that's when you pay your co-pays and your co-insurance. And you do that until you and your insurance provider have a combined medical drug cost of just over $5,000. If you exceed that amount, you then break through the ceiling, and then you slide into the coverage gap. What happens here if you move into this period is now you're paying about 25% out of pocket for the prescription medication until your out-of-pocket expenses reaches $8,000. Think about the $8,000. That's just Part D. That's not even talking about the other parts I'm talking about. This is how expensive Medicare can be. And on the coverage gap, it's not us and the insurance provider. It is just us paying, $8,000 out of pocket. Once we break through that, if we break through that, then we move into the catastrophic coverage period. At that point, the insurance company pays for everything. We no longer have a medication cost. That's the good news. Last year and years before that, we were still paying 5% of the medication cost. So even if you broke through $8,000, you're still paying more. The good news due to the Inflation Reduction Act is that once we break $8,000, that's it. We're not paying any more for that. Speaking of the Inflation Reduction Act, I want to talk about some of the changes that happen with Medicare, really important changes that a lot of people don't know about. We know President Biden passed this August of 22, trying to reduce the crazy inflation we all face. What some of you might not know is there was a lot of great things in that bill that relates to Medicare Part D that changed. And next thing I'm going to talk to you about some of those changes. Now, last year, what was fantastic is some of the Part D vaccines are now paid for at 100% of the cost. And as I say that, you might think back to the beginning where you said, well, yeah, anything preventative falls under Part B at 100% of the cost. That is true, but some of vaccines fell through the cracks. And the biggest one is shingles, okay? A couple of years ago, it cost folks $500 to $700 to get the shingles vaccine. Just, blew people's hair back. It was that expensive. So what's great is that the government recognized some of these vaccines that fell through the cracks and they packaged them through the Inflation Reduction Act under Part D, and now they're paid for at 100% of the cost, as is no matter which of the 3 or 4 phases you're in Part D. If someone has diabetes and needs an insulin shot, your copay is now limited to $35 an injection. This year, what's really important is, like I just said, that 5% co-insurance, that 4th phase, is gone, okay? That just happened a few months ago. And they're going to impose a premium cap on these insurance companies, saying that you just can't jack up rates on the citizens enrolled in Medicare. There's a cap on that, and the cap is 6%. They cannot exceed an increase north of 6% on your premiums. Then also they're going to expand what we consider low income, okay? As it stands before, is anyone that falls within 135% of the federal poverty level. This year, they're expanding that to 150%. Because again, this is just meant to make medication more affordable for folks. 2025 is a huge win. We should all, high five and raise the roof on 2025, because now, remember I said on the previous slide, $8,000 max out of pocket. Next year, $2,000 annual cap on your Part D spending. That is fantastic to make Part D more affordable for folks. And then wrapping up on this slide, the way this is going to work is, so what's going to happen from 2026 to 2031 is the government is going to take about 10 drugs a year, okay? So about 50 drugs over that time period, and just renegotiate the crazy prices with the big pharmaceutical companies, making them more affordable for folks on Medicare with some of the, medication like heart disease or, cholesterol, arthritis, things like that. They depend on, they're going to just rework the pricing and make it more affordable for folks. So all good news on this slide as well. So let's close the book. I said there's 2 options. Let's close the book on the first option you have, which is getting original Medicare A and B, adding a Medigap plan, right? Remember that, and then getting a Part D for your medication. That's one option. The other option you have, the often confusing option people have, is getting a Medicare Advantage plan. How do these plans work? Well, we're going to talk about all of these plans now. So the way these work is getting it through a private insurer. And again, this is where you have the option, this is Part C, of getting all of your coverage through your Medicare Advantage plan. So why people love these is because they're easy, right? They make sense. They work very similar to group insurance, where you don't need like 15 different moving parts like you do with the other option I have that I just told you about. They make them simple and easy. The insurance companies know what they're doing. They package these to get people to go these routes. So the way these work is actually similar to group insurance, as you might have it now, where depending on the Advantage plan you get, It might work in an HMO capacity or PPO capacity. You need to typically stay within the walls of that network. You can't really go outside of it, except in the case of an emergency. And, again, people love these because as long as you get one in the fall, then you can really get any advantage plan that you want, okay, during the annual election period. And, again, they make them easy. So a lot of times they're going to include hearing and dental and eye vision, things like that, gym memberships, all that type of stuff. Now, be aware, though, sometimes you might hear doctors not loving the advantage plans. And one reason for that is you need prior authorization. You can't just go and get every procedure done that you want. You can, do so as long as you get prior authorization through your advantage plan. Let's go back to my broken knee example. And the doctor says, hey, I want to, take a closer look at your knee. Why don't you go ahead and get an MRI? Well, I can't just go get that MRI. I need to make sure they're going to pay for it. And that could take weeks, as you all know, dealing with an insurance company, right? And you can see how frustrating that can be to a physician who gave me a diagnosis, and we can't just move forward with that diagnosis. So that's something to be aware of. But again, people love these because you're paying a much lower premium, or in most cases, no premium at all in Medigap, but you kind of pay for co-pays and co-services as you go. And that's what we're going to talk about on this slide, what it might look like. So the way it might work, again, there's many different plans, is it might work something like $20 to see your doctor, $50 for a specialist, maybe $300 for an ambulance, kind of a la carte, things like that. And then really important, folks, on this slide, in the middle is I want to draw your attention to something called OOP, which is your out-of-pocket max. Some of these big ticket items here, you might be paying 20% out of pocket that you didn't plan and expect for until it reaches this year $8,850. Last year, that was about $8,300. 2022 was about $7,400. You can see the trajectory of how much that's going up. And why I'm telling you this is because this is the stuff in the TV commercials they're not going to tell you. Almost all the TV commercials, telemarketer calls, flyers, almost all of that stuff, folks, that's the advantage plans. It's an insurance company trying to sell you on how great it is, how cheap it is, how free it is, all this kind of stuff. That's the way these work. And it oftentimes not going to tell you about this max limit, that if someone didn't plan for that, say someone got sick and had cancer the end of the year in Q4 and the coverage carried over into Q1, well, that person may have just dropped $20,000 out of pocket in a 4 or 5 month window that they didn't expect for. They didn't know about it. And then think about how catastrophic that potentially can be to someone's retirement plan. Okay. So we just want to know how the game's played. We want to know how these plans work. And I want to draw your attention here to 7 in 10 plans last year had a 0 premium. That sounds awesome, right? That sounds phenomenal. Who wouldn't want to go that route, right? It almost sounds a little too good to be true. I'm not sure if this passes the smell test. And it begs the question, a Medicare Advantage plan is bad. Are they trickery? I'm not here to say that they're bad or the trickery. I'm here to say that they're very often misunderstood. And it's important to know how they work so then we can make, again, the best educated decision for ourselves. I know some folks who love the Medicare Advantage plans because they're cheap and they're affordable, okay? The thing to be aware of is that if someone becomes sick, there's unexpected costs here, some of these big ticket items. You have kidney failure and need dialysis, cancer treatment, home medical equipment. We might be paying right here up to 20% out of pocket for these items. I'm not saying every single plan has that, $8,800 max out of pocket. That's think of that as a federal ceiling. You might find a plan that has a $5,000 one or a $6,000 one, but it's important to know that they do have that out of pocket limit that people don't expect for. And again, they're not going to tell you this on the commercials. There's a lot of marketing dollars that goes into the advantage plans. Remember I said there's 10 Medigap plans, okay? If we were in the room, I would ask all of you to raise your hand and shout out to take a wild guess how many Medicare Advantage plans exist in the world. And the person who comes closest to 4,000 would be right. Think about that, 10 Medigap plans versus 4,000. Why is that? It's because the insurance companies make a ton of money on these plans and they have marketing budgets, they have big budgets to incentivize folks to go into these plans. I am not here to say that they're bad. I'm here to say that there's marketing dollars to get people to want to go into these plans, and just be aware of the Medigap plans being more expensive, less out of pocket, the Advantage plans being cheap. Oftentimes they sound like they're free. no premium, but if you become sick, they can get quite expensive quite fast. So just be aware of the differences of the two. And then moving on to this slide, what we want to do is give you some tips if you want to go this route. First one is to build that rainy day fund for potential healthcare costs that you might not be paying when you have a zero premium, but then if you become sick, just have a side account, to budget for that. Okay, if you want to go this route. Know that, how and when you enroll matters. You want to enroll during the annual election period. If you travel, you might want to find one that has a national network, so you're not confined within the geographic regions of a small network. And then really important is number 4 is don't forget to reevaluate your plan each fall, because what's going to happen in September for folks who have the Advantage plans is they're going to receive in the mail something called an annual notice of change, and that's going to outline the following year all of the changes that's going to happen potentially to their Advantage plan. Now, they may take some benefits away, they might add some benefits. But if someone didn't bother to read that, and then come January 1 or anytime after that, right, and something they depended on was gone, you could see how that person could be in a really tough spot, not have the coverage that they need the following year. So that comes out in September, and then nicely the next month, by design, is the fall where we can shop Advantage plans. If coverage that we need was taken away, then we'd have an open opportunity to shop different plans, find when that works best for us. Okay. So again, that brings us to Medicare misstep number 2, and it's really folks just not understanding how amazingly different the Medigap plans work from the Advantage plans. Okay. Now I know we're coming up on time. I do want to leave some time for Q&A, but it's really important to talk about this next topic, which is working past age 65. This is often a confusing question for folks, and I want to make it easy as can be for all of you, where think of the government drawing a line in the sand at right here. If your employer has 20 or more, 20 or less employees. If you work for a company that has 20 or more employees, then it's considered a large employer, meaning that you can absolutely delay enrolling in Medicare at 65, and there's no penalty for doing so at a later time, because the government's going to see your group coverage as primary and Medicare coverage as secondary. Okay. So sometimes what you see folks do is they'll work for a large employer and they'll keep their group coverage, and they'll say, wait, well, I paid my FICA taxes, I'm paid up. I want to enroll in Part A because, why not have a secondary safety net if I go in the hospital? And you could certainly do that, and a lot of people do that. Just be aware, if you enroll in Medicare at any time, then you can no longer make contributions to your health savings account, because then you'd be penalized when you go to file your tax return. So if you want to enroll in Medicare, you'd have to stop making contributions to an HSA account. Okay. Some folks might not contribute to it, so they might not care. Other folks might want to pump as much money into those as they can, so then they have some money to pay for Medicare when they retire. Again, for everyone, it's different. I'm just here to talk about different options you have available to you. Okay. Now let's flip that. Let's talk about how it works for a small employer. If you work for a small employer, meaning one that has less than 20 employees, then the government flips it. All of a sudden, they're primary, and the group coverage you have is considered secondary. What I mean by that is now you would need to enroll in Medicare at 65 to avoid penalties later in life if you work for a small employer and you stay on your group coverage and didn't enroll in Medicare at 65, and you do so at a later time. Okay. I want to give you an example with that, because it's important to understand this. Say we have an electrician. He works for a company with 12 employees, and at 65, he stays on the group coverage, and he retires at 67. Okay, goes off the group coverage, goes on Medicare. There's a penalty for that. And the Part B penalty would go like this. Each year that you should have enrolled and you did not is a 10% penalty taxed on top of your Part B premium. So this electrician, right, 2 years he should have enrolled, he didn't. He now has a 20% penalty tacked on top of his Part B premium that never goes away. And guess when he found that out? Right, when it's often too late. A lot of people don't know about that. This is how we can avoid making mistakes. And it's important to know the confusion around this, because a lot of times we see family members or friends, there'll be at dinner parties and talk about this, and they'll say, no, you have to enroll in Medicare at 65. Or they'll say, no, you can delay, that's fine. As you can see here, they might both be true. What's important for you to know is, do you work for a large employer or do you work for a small employer? And just understand the rules associated with that and how the government defines, is Medicare primary or is Medicare secondary? Okay. Okay, I'm going to skip all of this in the essence of time. do a quick wrap up, and then I'm going to pass it back over to Gina for any Q&A that we may have received. So here we go. Quick high level wrap up. We talked about the 4 parts of Medicare, right? Where we know A and B is original Medicare. The only 2 parts we get through the government, where A is our inpatient hospital stay and B is our outpatient coverage. We talked about C and D being through a private insurer. We talked about Part C being the Advantage plans, and that's getting all your coverage under one roof, right? And then we talked about the Part D coverage being for any prescription medication that you need. Those are the 4 parts of Medicare. Next, we talked about how do we cover that gap that exists. First, I'll take the middle route. Again, there's different parts to this route, so sometimes this confuses people. But this is the route you will go original Medicare A and B, slap a Medigap plan onto it to cover that, remember that 20% gap, and add a standalone Part D plan. This is the more expensive route, so you're going to be paying higher premiums, but then you have little to no out-of-pocket costs after that, and we're not dealing with doctor networks. I'd probably encourage anyone who can afford this route to take it, as you get a lot more coverage for your dollars as well. However, moving down to the bottom route is the Advantage plans. That's the other option you have, certainly the cheaper option, and that is where you pay lower premiums or even no premiums at all. But there's more cost sharing, more unexpected cost. We want to plan for that. And oftentimes we do have a limitation on doctors as we're dealing with networks. And then moving to the top, I would certainly discourage anyone from only having original Medicare with no supplement at all. As we know, there's no cap on that spending. There's no cap on that 20% we're on the hook for. So if someone didn't plan for the gap with one of these 2 options, their retirement could be, our savings could be wiped away, and we don't want that to happen to anyone. And lastly, we just talked about this, but let's talk about it again, because it's very important, is working past age 65, and you work for a company that has more than 20 employees, then yes, you can delay at 65, and there's no penalty for doing so. However, if your company has less than 20 employees, then you must enroll in parts A, B, and D at 65 to avoid penalties if you don't do that and do so at a later time, do so later in life, okay? So next what I'm gonna do is pass it over to Gina. Thanks so much for your time today. Hopefully you all found this informative. For any questions, if we have any time left, that we can certainly entertain.
Yeah, thank you, Ron. Great presentation. A couple quick follow-ups. As I mentioned, since you did register, you will be getting the recorded link and also a couple of PDFs with some great resources and just some notes from today's presentation. So we will get that out within the next day or 2. I know we're right up on the hour, but if anyone does have questions, please feel free to put those in the chat. We'll definitely do our best to answer those questions. If you think about a question later, please feel free to send a question through our team at 401k Plan Professionals. Thanks, Ron. Yeah, if you just go, I think I'll flash up our contact information here in a moment. But you definitely can send any questions through our team. If we don't know the answer, we can reach out to Ron or some of those resources and help you get that answer. I did want to mention too, as we're waiting to see if there's any questions, we do have a number of other webinars coming up. We've got some great webinars, Raising Financially Aware Kids, Women in Investing, 529 in College Savings. Look for that. You can register there with our QR code, or you can go to our website at 401k Plan Professionals. So thank you for that. It looks like we do have one question here. In the Advantage plan, what is the maximum for out of network? You did give the Ron, I think you did mention the in-network number. If I'm correct, I think it was about $8,800. Do you know what the maximum would be for out of network?
That's a great question, and I do not know, so I don't want to misquote that. Yeah, you know what? Let me dig into that, and I can get back to that individual, because I want to answer it where it's all grouped under that out of pocket max. But sometimes if people go out of network, it can get real expensive real fast, and I don't know if someone was to hit that ceiling, if that would qualify for the out of pocket, right? Count towards that, or be outside of that. So that is a good question. I haven't got asked that before. And I would thank that person who asked that. Is that something new that I'm going to find out? As we know, there's so many moving parts to Medicare, and I will reach out to Gina if we have a second. If all of you want to stay with us, one thing I forgot to do, because I did want to make sure we had any questions, is I wanted to give a shout out to Boomer Benefits, as they are the folks who created this presentation for John Hancock to deliver today. They're outstanding. This phone number goes right to Lauren. She's dedicated to us. If any of you have questions, you can call her. Or if you just want to know more about Medicare, they have a lot of fantastic blogs and just different tutorials on the topic. Because I know for me, when I don't know if this happened to any of you, when I Google Medicare, like 5,000 things pop up and it's all this Advantage plans. And it's so hard to know, where do you go for credible information? And is it just an insurance company trying to sell me a different product? So if you do want to read more about these, there's a lot of great blogs, and I would trust them to give you credible information. And these are the folks I'm going to call, because whenever I get asked a question, I don't know the answer to them. Boomer Benefits is who I go to. So I will get the correct answer for that, and we will reach back out to that person. So thank you for asking that.
Great. And somebody did ask if they'll receive a copy of the PowerPoint presentation. We can include that with the recorded link and some of the PDFs as well. So no problem there. And then another question, how does it work if at age 65 you want to stay on a spouse's medical insurance instead of Medicare, or is that even possible?
Yes, it is. So at 65, we want to go back to, well, I'll use this one. So if you're on your spouse's group insurance, does your spouse work for a large employer or a small one? Oftentimes it's a large employer. So you don't have to go on. And what you want to do here is you want to just do kind of a price comparison. Does it make more, budget sense to go on Medicare at that time? Or you also have the option to go, stay on the group coverage. And as you can imagine, every employer is going to give, different, it's going to have different costs associated. So you're going to want to do a little bit of math to see if the Medicare, option is best for you, or if the group coverage is best for you. And just know that at 65, if you're on group coverage and it's a small employer, then you would want to get the Medicare at 65, because if you do so at a later time, that's when those penalties come in. Again, if it's that large employer, you have the option of doing a price comparison to see what's more affordable for you. But you don't, if it's a large employer, you don't have to at 65.
Great. Awesome. Thanks for recapping that. Let's see. I don't see any other questions in the Q&A or chat. Again, more information coming after today's presentation. So hopefully that'll be great resources for you, answer any additional questions you have. But again, on behalf of our team, I want to say thank you, and a big, huge thank you to Ron. Ron, I noticed, I don't think anyone hopped off the presentation early. So you did a fantastic job. And again, to all of our clients and plan sponsors who joined us today, thank you so much.